Good evening, ma'am.
Hi, good evening. Which one was this? Bhavna, if I'm
Yes,
not
ma'am.
wrong? Yeah. I see you studying in India or are you working?
Ma'am, I'm in India. Right now I'm working in a school as a school nurse.
Oh, great. So what are your future plans? Have you applied
Act-
for,
yes, ma'am.
yeah, tell me.
Actually, we have applied for Australia PR and side by we also applied for Canada PR as well. Because for last
Okay.
5 years, my husband was staying Australia, and
Okay.
now we are just waiting for our PR, and it's been a long time we are waiting. So we decided
PR
to
of Canada or Australia?
Australia.
Okay. Because Canada will take around 1 year, I guess. Not more than
Yes.
that.
So we
Huh?
just we just enroll with one agency and we have applied for Canada PR as well. Which one
Hmm.
is come for us first? We will
Whichever will come first, you'll go.
yes.
But you do know now for Australia, you need to clear OSCE also after
Yes,
this thing,
yes,
and it
yes.
is around 4 lakhs if I'm not wrong,
I think
two
two
to four
lakh,
lakhs, I
two
guess,
lakh.
2 lakhs. Yeah, if you complete it in the first go, then
Yes,
because I was
yes,
also thinking about Australia, but then like just because of these exams and all that, and
yes,
it's like if you're not working there, it's a very minimal chance, like it's around 50% chance that you'll pass it. So you have to
yes.
work in their environment.
It's really difficult. Like we
Yeah.
have to practice and practice for, and it's like a 10 station they give to us. And every
Mm-hmm.
station they have some 10 or 15 points, something like that.
Yeah. I remember I applied through AFRA first, but then I changed my mind and I went to USA.
USA. Okay.
Yeah. So I got my
I-
license really quickly for New York. So
Okay, Ram.
now I am a New York licensed nurse, but I started in India only. I let other people also come. I'll give my bio
Okay, ma'am.
once and for all. Yeah.
So I think, ma'am, in USA, they have like more. Uh, in USA, the requirement of English is not like 6.5, right?
Yeah.
As
Yeah.
compared to Australia, they need every in each module they need
Yeah. They
seven.
need it more than 7, I guess. Yeah.
No, in trip seven in every
Yeah.
module.
I know. I
And
cleared
I'm
my
also
eyes also. I did
I
everything and then I was,
I
yeah,
also
tell me.
got stuck in IELTS PT both. Like I just
Yeah.
take like 6.5. I got stuck on this, not
You can
7.
always try for Canada first. There's no harm. Yeah, or
Yes,
you can keep the Canada thing, like the application in the express entry, and you
yes,
can go wherever you want. And whenever it is done, the PR is done, you just move to Canada. Yeah.
yes. And ma'am, how's the NCLEX exam? It's like really tough for what?
No, it's not. I am telling you by my own experience, I cleared it through 1 month of studies. I just did study for 1 month and after that I cleared it. But to be honest, like if you keep the classes apart, I did not study much about the theoretical part. I was more into MCQs. So I used to solve
Okay.
around 60 to 70 MCQs every day in the morning and with a time lapse, like in 1.5 hour or 2 hours. And as you practice, you tend to do it faster. So that's how you make your speed and all
So
that. Yeah.
like we have to
Because time will be an issue. They will provide you questions around 75 to 150. It depends on your test. Everyone has their individual test. So if you get around 75, you'll get 1.5 hours. If you are getting 150 questions, you'll get the whole 5 hours. ऐसे
and
करके
ma'am,
होता
what
है.
is the passing score like 85?
I mean, they never provided the passing score. They just gave us a certificate. So I don't know about the scoring system. But I do know that the best me. I mean, the chances increases if you get less questions. I mean, that was my experience.
Okay, if we got like less questions, so
Yeah,
there may be a chances
because
to not
one of
clear.
my colleagues, she got whole of 150 questions and she did not pass, unfortunately. But I got only around 85 questions and I passed. So that
Yes,
was my
I've
that was
also
my
heard
conclusion.
one of my friends like if
Hmm.
all in starting if we correct all the answers and the level
Yeah,
of our
maybe that is
questions
the
will be
thing.
increased,
But to be honest, in
difficulty
theories, like
level.
you can study on your own, but basically the questions will matter. Like
Yes, ma'am.
that is the thing you have to focus on more because I never focused on theories, to be honest.
And also, ma'am, like it's been a gap. I have cleared my post BSc nursing from 2021, and after that,
Okay.
I have no touch with my studies, nothing.
Then the good part is, do you have touch with your clinicals?
Sorry, ma'am.
Do you have touch with clinicals? Do you have
Yes,
clinical
yes,
experience?
yes. Like
Yeah.
I worked in Max Healthcare for 1 year
Mm-hmm.
in medical intensive care unit,
No, at
and
present, are you working? Are you
yes,
working in a
present
clinical
I
setting?
am working not in clinical setting. I am working in school because if I work in clinical setting, then I don't have any time for studies.
Oh, okay. But the thing is, in NCLEX, they will not ask you about theoretical that much. They will ask more about the practical knowledge. So their questions are based on that. Have you ever done a mock test before this? Like, I want to ask that what all have been covered and what are we going to do next, then we'll decide.
Ma'am, in
Okay,
this class we have covered our nervous system.
that's all.
Yes.
That's all.
Yes, nervous system we have completed like I
So,
think
hmm,
10 or 12 nervous system disease we have studied.
okay. So
Ma'am,
today we'll
ma'am,
be doing. Hanji, bataiye.
I said ma'am told us that few things are remaining that she was about to teach us today.
What
Yeah,
what?
diagnostic test. One was diagnostic test, and there was one another disease she was talking about. Don't remember the name.
Diagnostic test can be a different topic because it comes in the practicals of nursing, right? So it can be taught together with all the diagnostic values and lumbar puncture and all those things. That is
Okay.
what you're referring to, right? Lumbar puncture and
Yes.
uska CSF analysis and all that.
Yeah, yeah. Ma'am just said
Okay.
that diagnostic tests are remaining.
I'll tell you. The main question from lumbar puncture you'll get is, what is the position used?
And lateral bit, lateral during
And
lateral and then supine.
supine nahi hota.
Sideline
Supine after
Lateral
position.
that.
and
After that. After the procedure supine.
on the cardiac
Before it
table,
is
what do you
lateral.
call that position? You're sitting on the cardiac table. Your back rests on the cardiac table. What do you call that?
Sideline position, ma'am.
Sitting position. Sitting
Okay.
position. Yeah. Because I remember there was only one question related to this. As such, CSF analysis, you will not get that much, but we'll study it in the diagnostic values. It will be covered in that. What else is left? Hello.
Yes, ma'am.
Uh, Anything
No,
else left in the nervous system?
I think that was the only topic that was remaining.
Actually,
And
ma'am,
just
Okay.
most of the
on.
topic will be covered, but we know actually we just have theories like normal diagnosis and what is the disease. Like
So
basic
you
we are
have
studying
you have covered the
bachelor's.
theory. You have covered the
Yes.
theory of nervous system. So today we'll be doing the mock test for that. Okay. And it's not like we'll just uh, discuss the questions. We'll also discuss their answers and their rationales will also be given. So we can discuss that side by side. Is
Yes,
that
ma'am.
fine with you all? So if
Yes.
you are unaware of some facts, you'll just get to know it then and there. Okay. And you can write it also. Okay. And
Yes,
also
ma'am.
about after the class, I'll be giving you a sample question paper for your homework, and that too with answers. So one question paper is just like that. just the questions, and the other one is with the answers. So when you solve it, you can look at the answers and look at their rationals. Okay.
Yes, ma'am.
So is there anyone else joining, or shall I start? 6:37, right? I'll just start it. First of all, my name is Captain Suruchi, and I did my bachelor's in nursing from AHR at Delhi University. And after that, I was commissioned to Army as a military nurse. I did 5 years of experience in military nursing. And after that, now I have gained my New York license in like 2-3 months back. So now I'll be shifting to US for that. Okay. That's all about me.
Great.
Do you guys mind giving me your introduction and
Yes,
switch on your
ma'am.
cameras?
Myself, Farhad. Okay.
Okay.
Okay,
Farhad.
ma'am, I think,
Farhad.
yeah,
No,
yes,
speak.
myself,
Bataiye.
I said myself, Farhad, and
Mm-hmm.
I just finished with my final semester exam, so my 1 year internship is remaining.
Okay.
Yeah, so I'm
Okay.
fresh graduate, you can say.
Fresh graduate, no? Okay. No problem. Are you working somewhere?
No, I just gave my final semester exams. I don't have a degree yet.
Okay. So you don't have any internship or nothing?
No, nothing. I'm zero clinically.
No, it's okay. And okay, thank you, Farhad. Next is Bhavna. Tell
My
me.
name is Bhavna, and I have completed my bachelor's of nursing from Rajiv Gandhi University. And I have worked in Max Healthcare and Central Government Dispensary for I and almost I have 2.5 years of experience. And currently,
Okay.
I'm working in school as a school nurse.
That's perfect. Perfect. Now, Sasikala ji.
Yes, I am myself Sasikala. I'm completed BSc Nursing in MGR University. I have 5 years experience. 4
Okay.
years experience in intensive care unit in Adayar Cancer Institute, and that
Okay.
is in Chennai. But
Oh,
now as I'm working as a occupational health nurse.
oh, great. So you'll be having thorough knowledge of oncology as well as occupational nurse. What is your specialty in that? Occupational nurse may, I think you'll
Primary
be
healthcare
managing
work.
all the okay.
It's
Med surg,
primary health. Yes, yes,
right?
yes. Yes.
Okay. Great.
That's
And
it.
Govind Raj?
Graduation in Rajiv Gandhi University, and I have 15 years experience. So
Okay.
I worked in 2 hospitals. So right now I am working occupational health nurse at Pfizer.
Okay. Great. So where are you planning to move? Are you all planning for Canada
So I
or
try to
somewhere?
No, ma'am, I'm
whatever
planning
it
to move
is,
you.
which one is possible, we can do.
I'm
Okay,
planning to move in the
great.
USA.
That should be the spirit. Next is Rupa.
Hi, ma'am. Good morning. I know, good evening. For me, good
I
morning. Uh,
I
I have finished my nursing. I'm just GNM, like maybe like 20 years ago.
okay.
Moved to Canada around like 10 years ago. So, because of the family and kids, I just left my nursing and I
Okay.
want to do my nursing. It's my ambition. So again, I started doing it. I'm a repeat
Oh, so you're
taker.
planning to rejoin? That's perfect.
Yeah. Yeah.
Yeah.
I like nursing,
Okay.
like that's my passion, but because of the family, I have to leave. So now the kids are okay, so I have to go with my ambition. So I just
It's okay
stick.
to take a time lapse. It's okay. That's
Yeah,
why, like, nursing is the best profession for that, to be honest. You can start anywhere, anytime.
yeah.
And you're
So I
already in
did.
Canada, so you just have to give the
Yeah,
exam. You must be
yeah.
aware with the clinicals, right?
I work in dialysis unit as a NA, like
Hmm.
nursing assistant.
Okay.
So because when I came the Canada, it was so strict. They didn't even open anything.
I know they are.
So yeah, 2 years back I did
But
bridging programs.
if you look to the good parts, the best thing is that you are aware of the clinicals over there, because of the settings over there,
Yeah.
because the rest of the crowd, they are still requiring that exposure which you already have. So you have an upper hand on it. Okay.
Thank you.
Next, Priya is
So,
done,
ma'am,
I
did
guess.
you pass NCLEX US or NCLEX Canada?
I passed NCLEX Australia. And after that, I had to switch because my in-laws are staying in USA, so I had to move. Okay.
That's it.
Kawaljeet is left. Kawaljeet.
Hi, good evening, ma'am. Sorry.
Hi.
How are you, ma'am?
Tell us about yourself.
My name is Kavanjeet Kaur. I'm basically from Punjab, Amritsar,
Mm-hmm.
but I'm
Mm-hmm.
working in Bahrain right now as a RN.
Okay, great. Priya is done now. Priya was done,
So,
right?
Hello.
sorry, ma'am.
Hi, Priya.
Hello. Good evening, ma'am.
So, are we done with your introduction? No,
Yes,
na?
myself Priya, completed GNM, 5 year
Okay.
experience.
So you all have basic experience in nursing. There is no one who is coming from another background. That's a relief. Okay.
Yes.
So today we'll be doing the mock test for the topics you have covered. Basically, very general questions, which are previous NCLEX questions, and we'll be doing it from UWorld. It's a very well-known website. You can check it online, and we'll just see how much you have cleared the nervous system, and if there are any doubts, we can clear it next week. Okay, so I'll just share the screen. Is the screen visible?
Yes,
Give me
ma'am.
a
Yes, ma'am.
okay.
Yes.
Yeah. So our first question is, so I'll be very honest with you guys that the questions are not very related to the theoretical part. It's more related to the practicals. It's my experience. Okay.
Yes.
So I'll be giving you mock tests for your home also, and you can do it later on. But try doing all of the questions, because if you don't practice questions, theory will not matter. Okay. I used to do 60 questions every day, and I passed it in 1 month, and I never touched theory, to be honest. Okay. So questions are more important. Okay, so the first question is, an 86 years old client with diabetes and gastroparesis has had repeated hospitalization for aspiration pneumonia following a stroke, and is now hospitalized with altered level of consciousness. Which nursing action is most appropriate to decrease the client's risk for developing aspiration pneumonia? What do you people think should be the answer? I'll go with the majority. Read the question.
Ma'am, I think,
Tell me.
ma'am, it is the third one.
Titrating client's oxygen to maintain saturation at 93%. Okay.
Yes,
It
ma'am.
is, ma'am, more than
So,
93.
Less
which
than
nursing action is most appropriate to decrease the client's risk for developing aspiration pneumonia? Aspiration pneumonia is what?
What, ma'am?
Respiratory.
Aspiration? Yeah. Exactly. So assessing client's breath sound every 2 hours. Most appropriate, placing client in the sideline position in bed. Nobody's looking at this.
I
Okay.
think this is the second, ma'am. The answer is second. Because if we give the sideline, the less chance of aspiration.
Okay. So most appropriate may
Ma'am, we can
we'll
follow
tick mark the second
airway
one.
breathing circulation, right? ABC.
Yes. That's what I was about to say. That most appropriate. You have to look at the words. You have to look at the question. Read it twice. Read it thrice, and you'll get to know when it is written most appropriate. First thing is that ABC.
Yes.
We
Okay.
provide the sideline position, then airway will be clear.
Yeah. And oxygenation, titrating client's oxygenation. See, NCLEX is a nursing test. Okay,
Yeah.
it's a nurse's test. So for titrating, you have to ask a physician, to be honest, because
Yes, we can.
yeah. So they will always provide these kind of clues, subtle clues that okay, your physician is telling you to do this. If physician is telling, then it will be a priority. Okay, so you have to solve questions. To be honest, the more you'll solve, the more you'll get like their type, how they are forming questions and how their answers are formed. Okay, so you can read the explanation. Once it's done, just let me know.
Client
And if
with
someone,
decreased level
yeah,
of consciousness may not be alert enough to protect their own airways. Therefore, a side-lying or lateral position is used to decrease the risk for developing aspiration pneumonia. If vomiting were to occur, this position will promote drainage and emesis out of the mouth instead of down the pharynx, where it can be aspirated into the lungs. Maintaining an upright position during and after meals will allow remaining food particles to clear from the pharynx.
yeah. Kavaljeet, you can just mute and read because other people are not able to understand. Sorry. Okay. Does anyone has any doubt in this? Because then we can move on to the next question.
No doubt, ma'am. Ma'am, this is you, right?
Yeah, this is you, Will. Next question is, the nurse is giving a presentation at a community health event. The nurse should provide which instruction on how to prevent botulism? Botulism पढ़ा है? नहीं पढ़ा तो मैं फिर आगे कर रही हूँ. It's a GI का topic if I'm not wrong.
नहीं पढ़ा.
नहीं पढ़ा ना?
Answer is two, ma'am.
But to be honest, you can answer this one. See, it's so easy.
Two, ma'am.
What will cause botulism? Botulism is sort of gastritis only. Gastric discomfort. इसमें से just make a guess. Make a wild guess. I just saw the question ka answers and I can guess it. Out of the four options, which can literally upset your stomach?
Unhygiene.
I
Wash
think
hands.
fourth one, wash hands.
Wash.
Second, what about the second one? Do you have
Food,
juice
fruit.
trauma?
I'll go with
Do
second.
you have juice with a buzzing end? Do you have milk with a buzzing end? No, never. Okay. So what is it exactly? Botulism is caused by the gastrointestinal absorption of the neurotoxin produced by. Okay, it's somewhat related to neuro. The neurotoxin blocks acetylcholine at the neuromuscular junction. I think we studied in gastric system, if few people don't mind. Okay. You have not studied this one, huh? So I'm going to the next question.
Okay.
Okay. I'll just write the topics you people have missed. Botulism. What else was there? CSF and lumbar puncture, right? Is there anything else left in neuro?
Ma'am, lumbar puncture, I think we already had studied.
Okay, so are these topics visible to you guys?
Yeah.
Is my screen visible?
Yes,
Hello?
ma'am.
Yes, ma'am.
So just
Yes, madam,
tell
you
me, have you studied skull injury?
Yes, ma'am.
Yes, ma'am.
Have you studied hydrocephalus?
Hydrocephalus we haven't, but we
No, ma'am.
नहीं हुआ?
Just missed hydrocephalus and stroke. If,
rest of
Hydrocephalus
is
and
completed, ma'am.
We are
Only
just studying
hydrocephalus and
One
neurotransmitters.
person at a time. One person at a time.
Okay,
ma'am.
ma'am, we are just studied neurotransmitter and their functions, CNS, and their anatomy and
Ma'am.
physiology, skull injury.
Ma'am, in
Okay.
short, we have studied everything in this list except stroke and
Yes.
hydrocephalus.
Yes.
You have not studied stroke. Okay. And hydrocephalus. Hydrocephalus is like a little brother to meningitis. Nothing more. Okay. So tomorrow we'll be taking these topics then, whichever was left now. Botulism, CSF, lumbar puncture, stroke, hydrocephalus. Okay?
Yes, ma'am.
And we'll see. Maybe there are more topics also. We'll see the questions. Okay, so the nurse completes a neurological examination on a client who has suffered a stroke to determine stroke to padai nahi hai. Next question. The nurse is talking with a client who is scheduled for a lumbar puncture. Which of the following statements by the client would require follow-up? Can you answer? Can you try to answer?
Yes, ma'am.
And the first one.
I will need to lie on my stomach during the procedure. No.
Yeah, ma'am, it is lateral now, so we need to follow up on this statement.
Get your English right then. See what is written in the first one.
Ma'am, it's a
That-
third one.
Third one, ma'am.
I understand that a
understand
needle
that
will be
needle will
inserted
be
between the
inserted
bone
between the bone
in my
my
lower spine
during the procedure.
during the
I think
procedure.
third, ma'am.
No, ma'am. I'll go
No,
with
ma'am.
first one because
Second
they
one, ma'am.
said
Second one, I think.
Ma'am, second one, ma'am.
no, it
Before
needs
procedure,
follow-up.
anything wide.
Third one, ma'am. Third
Yeah,
one.
second one.
Third one is
Second one, ma'am.
confirmed.
You don't need follow-up for the second one.
Madam,
Second one, ma'am.
Anyways,
every time when we
Ma'am,
are doing
I-
a lumbar puncture
See,
procedure,
ma'am,
after that
I will.
spine position
told
is
you.
rotated.
someone, yeah. I was just
I
checking
told
you
you, ma'am,
people,
it's
okay?
first.
Yeah. So how was it?
Because ma'am,
How?
ma'am yesterday told us that the patient during the procedure should be on lateral position, not on the stomach. So if the patient is saying that I would lie on my stomach during the procedure, it is wrong. So we need to follow up on this.
No, I want to ask the other people that why did you say 2 and 3? What was the reason?
All the others are correct.
What did the question mean by follow up?
We have to select the wrong.
What
but
would
we
require
select the
follow-up?
correct.
What would require follow up as in that what is it that the patient is doing wrong, which you have to correct. And this sentence will come in various questions. And the questions are formed like this only. So just see the question formation. Okay. Can you people mute? Can someone mute? Like there is some hustle bustle going on. I think it's Emmanuel.
Yeah,
Mohan,
yeah,
please
ma'am.
mute.
Yes, ma'am.
Okay, you can just study or you can just read the explanation.
Ma'am, I was when I was in a neurology ward. That time, most of procedure when our consultant doing, and after that, they were patient tried to after procedure try to patient sleep on a spine position.
You can speak in any language you are comfortable. Just speak
Okay.
in Hindi. I'm not able to
Okay.
understand the question. Tell me.
जब मैं मैम ये न्यूरोलॉजी वार्ड में था उस टाइम मोस्ट ऑफ प्रोसीजर जब आफ्टर लंबर पंचर पेशेंट को जो थे स्पाइन पोजीशन में वो करवाते थे थोड़ी देर उसको लेफ्ट लेटरल होती थी आफ्टर दैट they are comfortable for they are instruct to the nursing staff and patient left on a spine position.
Yeah, so there are two type of positions given.
Okay.
You can just mute it. I got your question. You can just mute the thing. Yeah. So I'm saying there are two types of positions. Okay. So is this the one you
Actually,
used to
ma'am,
give?
there is too much disturbance from someone's phone.
It's Akram
Where
only.
Akram,
Akram,
I think out of that's
Akram,
why.
Akram and Mohan, please mute your. Please mute
Okay,
your. Yeah. Perfect. So it was Mohan's question, right? Whose question was it? Mohan's, right? Anyways, I'm just asking you that was this the position you used to give to your clients before lumbar puncture? Or was it the sitting position with your chest on the cardiac table? There are only two positions. First one is this, and the second one is sitting position with your chest on the cardiac, resting on the cardiac table. Okay, there are only two types of positions followed. So my main tip for this NCLEX is based on this question is that you have to see that required follow-up is written or not. And follow-up means what the patient is doing wrong that you have to follow up. Okay, that's all. Next question is, the nurse is caring for a client with increased intracranial pressure. Which statement by the unlicensed assistive personnel would require immediate intervention by the nurse? Unlicensed assistive personnel, pata hai? Do you people know? What is the UAP in foreign countries?
She don't
I
have.
think, ma'am,
She's like
unlicensed
a
nurse
assistant for the
assist
nurses.
by RN and LPN.
Yeah.
And its answer is 4.
So,
Number 4.
its answer is 4. Okay. Immediate intervention by the nurse. You should do deep breathing and coughing. Very good here. Correct. So others can just read. I think you have covered this topic. That's why it was so fast. Understood? Shall I move to another question? Right? Don't worry, I'll be giving you mock tests for these, huh? So you can just read from that. Okay?
Yes, ma'am.
Next is
Ma'am, the
the
same
nurse is
question.
assessing. Same questions, like similar questions, not same questions. But the rationales will be similar, so you can just read that. Or you can read it. Clients with elevated ICP should avoid anything that increases intrathoracic and intra-abdominal pressure, as these also indirectly increase ICP. Okay? These, the first line is more than enough, I guess. The nurse is assessing a client who sustained a spinal cord injury and has suspected neurogenic shock. Shock, have you guys studied shock?
Yes,
Different
ma'am.
types of shock? Okay. Which of the following findings would support a diagnosis of neurogenic shock? Specific.
It's the first one, ma'am.
Second
It is one hypertension.
Ma'am, blood pressure of 186/92.
Heart rate, ma'am. Heart rate of 48.
Heart rate
Beats
or
per
blood
minute.
pressure?
Sir,
People are
ma'am, heart
confused.
rate.
Heart rate, ma'am.
फोर
Sure.
न्यूरोजेनिक्स मैम शॉक्स
Blood
होते
pressure.
हैं
It
जिनमें
might
Neurogenic
be
जो
shock
blood
is
pressure.
वाहिद न्यूरोजेनिक शॉक है जिसमें पेशेंट जो है ब्रेडिकार्डिया में जाता है, बाकी सब में क्या
बहुत बढ़िया. Exactly. Iklauta difference. This is the only difference between neurogenic shock and all other shocks. He will go into bradycardia. So this you can just click a picture if you want, or there will be a recording of this class. So I'll just send it. Loss of sympathetic nervous system stimulation gives venous and arterial dilation हो जाता है, then decreased venous return, decreased cardiac output. If there's decreased cardiac output, you will certainly get bradycardia. Okay. Shall I move to another question? Next question.
Yes, ma'am.
Okay. What is written? Our client is being admitted for a potential cerebral pathology. Pathology to पढ़ा ही नहीं है. Which task should the nurse ask the client to perform to assess if cerebral function is within the defined limits? Select all that apply. There is more than one answer, so make a guess. Identify the number 8 traced on the palm. Shrug the shoulders against resistance. Swallow water. Touch each finger of one hand to the hand's thumb. Walk heel to toe.
मैडम इसमें से आप काफी क्वेश्चंस ऐसे कर रहे हैं जो हम टॉपिक पढ़े नहीं है, बट ये अकॉर्डिंग टू आवर एक्सपीरियंस
क्या आपने cranial? This is what the motive is of NCLEX.
Yes, ma'am.
I'm telling you,
Yes.
theory will not come. Your practical
Yeah.
will come.
Yeah.
मेरे साथ धोखा
That
हुआ
is
है.
a
That's why I'm
good
telling
thing,
you in
ma'am. We
advance.
are using our brain and brainstorming, so that's great.
I'm telling you, I will give, when I'll teach you the theory also, na, I'll teach you according to this. I will not teach you according to books, because books never come. They just don't come. The only thing will come is practical. What is the nurse's responsibility? What should the nurse do when the doctor is asking to do? That type of questions will come. Okay, and all the values, of course. So ये आप लोगों ने पढ़ा नहीं. आप लोगों ने cranial nerves पढ़ा है?
Yes, ma'am. BSN में पढ़ा था, but
नहीं, cranial nerves तो मुझे बोला हो गया है.
अच्छा
Cranial
हुआ,
nerves
लेकिन
नहीं हुआ.
पूरा 1-2
12.
लेक्चर्स मैंने मिस भी किए, तो मे बी इस वजह से हो.
तो cranial nerves
ma'am
के
told us
assessment
about
में आप
cranial
जो करते हो, वो इसमें उसमें से क्या क्या है? थोड़ा बहुत
इसमें
याद आएगा.
मैम नंबर 5
1, 4,
Number
5.
5. Walk heel to toe. Okay.
number 1
Number 1. Okay. सारे ही कर देती हूँ, एक काम करती हूँ. सारे कर देती हूँ.
नहीं
हाँ, तो फिर तो देख लो अब इसका सेरेब्रम किसके लिए होता है. सेरेब्रम क्या करता है हमारे ब्रेन में? एनाटॉमी तो पढ़ी है अब.
कोऑर्डिनेशन ऑफ वॉल्यूम.
हाँ, और हमें यहाँ पे क्या हुआ है प्रॉब्लम? उसको बेचारे को पोटेंशियल सेरेब्रल पैथोलॉजी हुई है उसको. तो सेरेब्रल से सेरेबेलम याद आ गया हमें. सेरेबेलम क्या करता है? हमारा वॉक हील टू टो, बैलेंस, मेन बैलेंस ही उसका काम. बाकी क्या है यहाँ पे लिखा? फिंगर टैपिंग. हाँ, एबिलिटी टू टच ईच फिंगर ऑफ वन हैंड टू द हैंड्स थंब. So these two are correct. Coordination and balance. I think you must have read this in your anatomy physiology. I'm pretty sure.
Yes, ma'am.
Yeah, so that's the thing now. You just see the question, you see the rationale, and you can just refer it afterwards also. Theory will not come. Practical questions from theory will come. These are the exact previous questions which came in NCLEX. So you have to practice these, okay? I'll just give you 2 minutes, just read it. And if there is any doubt, just ask me.
एक चीज है वैसे मैं पूछना चाह रहा था क्वेश्चन। जब भी ये साटा क्वेश्चंस आते हैं, इसमें एक चीज कंफ्यूजिंग ये होती है कि अभी देखें 4 to 5 के ऑप्शंस दिए होते हैं, 3 या 4 आंसर्स एक्यूरेट होते हैं। मैं ये जानना चाह रहा था, अगर हमारे 3 करेक्ट होते हैं तो आया हमारा पूरा क्वेश्चन एक रॉन्ग हो जाता है, तो पूरा क्वेश्चन रॉन्ग
हाँ,
कंसीडर
आपका
किया
आधे
जाएगा?
मार्क्स कटेंगे, आपके आधे
अच्छा,
मार्क्स
आधे
कटेंगे।
मार्क्स कटेंगे क्योंकि
अगर
इसमें
आपका 2 ठीक है और 1 गलत है ना,
जी,
तो एक ठीक वाले का मार्क्स कट जाएगा, उन दोनों से माइनस हो गया,
और
एक
कोई
मिलेगा।
नेगेटिव
तो
मार्किंग तो नहीं होगी उसकी
नहीं
अगर
होती,
हमारा?
नो
अच्छा,
नेगेटिव मार्किंग, नो नेगेटिव मार्किंग। बट वो इतना कंफ्यूज करते हैं कि नेगेटिव का जरूरत ही नहीं पड़ता।
हाँ ये बात तो है, बट ये सार्ट ऑफ क्वेश्चन काफी कंफ्यूजिंग होते हैं। मोस्ट ऑफ टाइम जो होते हैं
हाँ,
इनमें सारे ऑप्शन ठीक लगते हैं।
आप लोगों को क्वेश्चन प्रैक्टिस करने होंगे। आई बिलीव यहाँ पे कोई ऐसा नहीं जिसको हिंदी नहीं आती।
यस मैम, मोस्ट ऑफ सारी ऐसे हैं जो हिंदी
सबको
उर्दू
हिंदी आता है
समझते
ना? सबको
I
हिंदी आती
can't
है ना?
understand
No,
Hindi,
ma'am.
ma'am.
हैं। उर्दू हिंदी लाइक
Okay,
मैम
okay.
सिमिलर।
Okay. There is one who doesn't understand, so we'll just talk in English.
Two
Now,
No,
people.
okay.
four or five members.
Myself also not
Like,
understanding Hindi, madam.
Oh, okay. I think you people have joined late or something because
No.
okay.
We are
Nadia,
just
I did
following.
not
No,
see
no.
Nadia before. Nadia, can you introduce yourself a bit? I've not seen your face also.
Hello.
And who else has joined? Hi.
Hello, madam.
Hello.
जी मैडम, मैं नादिया फ्रॉम पाकिस्तान।
Okay.
मैं
Good.
मैडम सब में न्यू हूँ और आज ये मेरी फर्स्ट क्लास है। मैं बस खामोशी से आप सबको सुन रही थी, मैंने कहा अभी क्या
Okay,
करती
it's your first class, then you have not done the nervous system and you have not gone through that?
नो मैम, मेरे पास रिकॉर्डेड लेक्चर की लास्ट जो नर्वस सिस्टम के सारा आपने
Okay.
जो
Okay.
वीडियो है वो मैं बाद में
Pardon?
आफ्टर दिस वीडियो माय प्रीवियस लेक्चर।
Okay. So are you working right now? Are you working in clinical?
यस मैम, आई
Okay.
जॉब हियर इन। यस मैम।
So we are just proceeding to the next question. Anyone else who is new and who has joined and I have not met them? Muskan Hans.
यस मैम, आई थिंक आकिफ is a
Muskan
new
Hans.
one.
iPhone. There's one
Nadia,
iPhone.
no
And
ma'am,
there's
iPhone is a
Akib.
Akif
Okay.
Sahotran. Yes ma'am,
Akib Salwotra. Okay.
Akif and Nadia, there are
Okay, so we'll just go to the next question. The nurse provides education for caregivers of a client with Alzheimer's disease. Alzheimer भी नहीं पढ़ा होगा?
yes ma'am, पढ़ा हुआ है।
पढ़ा है? ठीक है. Which instructions should the nurse include? Select all that apply. Providing education for caregivers of a client with Alzheimer's disease. Okay, Alzheimer disease वाले को हम we are discharging the patient to the home with a caregiver and we are giving the education to the caregiver. So what should we tell them? Complete activities such as bathing and dressing as quickly as possible. Decrease the client's anxiety by limiting the number of choices offered. See, your basic nursing is tested over here. Nothing related to your theories, right? These type of questions will come.
I'll
Tell
go
me.
with 2.
Just think about
2, 3, 5.
what you think should be done. 2, 3, 5, you said?
Yes, ma'am.
2, 3, 5. Use open-ended questions when communicating. Very good. Redirect the client if agitated, by asking for help. We'll see.
Oh,
Decrease
no.
the client's anxiety. Even I am confused.
I think second number.
Second, third is right. Fourth was there. Remember to interact with the client as an adult, regardless of childlike effect. Okay. Use open-ended questions was wrong. So what should we do? Strategies for caring for clients with Alzheimer's disease address progressive memory loss and declining ability to communicate, think clearly, and perform activities of daily living. So basically, memory loss, they can't communicate well, they can't think clearly, they'll act like a child, and they have difficulty in performing activities of daily living. So caregivers should learn to manage clients' problematic behavior and mood swings. Therapeutic guidelines include use distraction and redirection, like going for a walk to manage agitation. Speak slowly and use simple words and yes or no questions. Okay. Do not try to rationalize with the client. Do not try to argue, rationalize. Just accept what they're saying because they'll act like a child. Use visual cues when giving directions. Okay. Interact with the client as an adult. Even as the client regresses to childlike affect and behavior, respect client's dignity by avoiding use of pet names, honey, sweetie, darling. Okay, ये सब नहीं करना है. Break down complex activities into steps with simple instructions. Just read it for future references because there will be other questions and they'll be formed in another way. But these
Ma'am, I
rationals
have
will
a
be
question,
helpful
ma'am.
that time.
Because I choose number 5 because it says open-ended question, right? So it is like yes or no questions.
Open-ended questions are not yes or no questions. They are like
No.
you have to give a description, like an answer. You have to describe something. That is
Okay.
open-ended question. So
Thank
they
you.
are opposite to that. So you have to use simple words like just yes or no questions. Have you eaten food? Yes. What did you eat? No. Go ahead. The graduate nurse cares for several post-doc clients. Which of the following nursing intervention are appropriate? Post-doc clients को तो बता दोगे आप लोग. बताइए.
Implement fall precaution. Number 1. Number 3, initial swallow precautions.
Number 4, ma'am.
I don't know about 4, ma'am.
1,
Okay.
3, 4.
Okay. So it's pretty much clear. You can just see if you had doubts with any option.
1
The
and 5.
options are 5. You had doubt with 5. Speak louder.
No, ma'am. 1, 3, 4. We are
You
short.
never have to speak louder. Clients experiencing receptive aphasia, impaired comprehension of speech and writing typically have injury to the Wernicke area of the brain, located in the left temporal lobe. The nurse would not speak louder as this does not aid comprehension. The nurse should speak clearly, ask yes or no, it may be yes or no here, and use gestures and pictures to increase understanding. Rational pakka pad lo, because there are other questions with same rationals and different questions, different type of questions.
Yes.
Just read it once, okay? Stroke से बहुत आता है. I guess nervous system में stroke is the main topic. Spinal injuries आता है. ये main diseases यही आती है. Spinal injuries पक्का आता है.
Cardiology, ma'am.
Pardon?
Cardiology, peds, gynae, and nervous system.
You will get only 2 of these topics. You will get only 2. I got psychiatry and midwifery.
Okay.
So you'll get just 2 topics widely, जिससे questions आएंगे, and you just need to be thorough with it. And जिसका pharmacology आ गया धन्य हुआ.
Yes.
Pharmacology जिनका आ गया then तो they'll only ask medicines of all the fields. So that's it.
मैडम मेरा क्वेश्चन ये था कि ये यूवर्ड क्वेश्चंस जो है एग्जाम आप कंडक्ट करेंगे हमसे इन फ्यूचर.
यूवर्ड क्वेश्चंस कंडक्ट करेंगे एज इन आपको मैं दे देती हूँ मॉक टेस्ट इसके बाद.
Yes,
वो यूवर्ड का ही मॉक टेस्ट है, ठीक है?
बस हम ये चाह रहे हैं मैम कि हमें अपनी परफॉर्मेंस का पता भी चले ना. ये तो भी आप मसलन
हाँ
लाइव ले रहे हैं सेशन,
हाँ हाँ
उसमें
हाँ
हर बंदे की
I'll
अपनी
हाँ हाँ
कैपेबिलिटी का पता चलेगा उसमें।
Yes, so I will be giving you a question paper of 50 questions. Okay. So just try to solve it in 1.5 hours. Okay.
ओके
And then I'll give you another question paper with answers and rationale. Okay.
ओके
Same question paper, uska answers and rationale. So you can check it afterwards. Okay. अभी के लिए आई एम जस्ट टेलिंग यू कि कैसे कैसे क्वेश्चंस आते हैं बिकॉज इफ आई गिव यू डायरेक्टली दैट थिंग यू विल फेल द एग्जाम
मॉक
देन
टेस्ट पहले दिए हुए हैं ये NCLEX की
ओके
जो
ओके
है,
ओके
वी आर नो।
दैट्स गुड बट आई थिंक UWorld इज द मोस्ट डिपेंडेबल according to me. I mean, and then simple nursing. Kaplan, I guess, it's not effective. I mean,
मैम
the
ये
questions are a bit
कैपलॉन
different.
ATI और सॉन्डर्स से ज्यादा आते हैं ना क्वेश्चंस जो हैं इनकी बुक्स में से।
I have not done with that. I have not done with that, and to be honest, I've not read books. I've not read books
मैम what
because
about
theories
author's
का मैंने
question?
करके देख लिया.
अच्छा
हाँ जी.
नहीं, आपने तो मैम एग्जाम क्लियर किया ना, आपने जाहिर प्रिपरेशन तो की होगी।
मैंने एग्जाम क्लियर किया एंड आई एम टेलिंग यू मैंने 1 महीने में किया. कोई 3 महीना
वाओ
नहीं, कोई 6 महीना नहीं. You just need to do one thing. I'm telling you, your practical should be up to date. कि what is
यस
happening
मैम
in ACLS, BLS, सबका लेटेस्ट गाइडलाइन, BMW का लेटेस्ट गाइडलाइन, सबका लेटेस्ट गाइडलाइन पढ़ के जाना. एंड सेकेंडली उनका इम्यूनाइजेशन पीडियाट्रिक्स में उनका इम्यूनाइजेशन क्या है, उनका हिपा, उनका एथिकल रूल्स एंड रेगुलेशंस क्या क्या है, वो उसका एक क्लास लेंगे ना. तो
यस
स्टडी इन
मैम,
दैट.
वो आप प्रोवाइड करा दें.
हाँ, but still, even if I take the class, questions are more important. So I'll just give you the questions. वो repeatedly करते रहना. And if you have any subscription to your Kaplan and वो सब अगर है, बुक्स में भी तो पीछे दिए होते हैं मॉक टेस्ट,
मैम
तो
बेस्ट
वो भी कर
किसका
सकते हो आप.
सब्सक्रिप्शन? UWorld का सब्सक्रिप्शन
यू
लेना
वर्ल्ड
बेस्ट है.
यू वर्ल्ड और उसके बाद सिंपल नर्सिंग. यू वर्ल्ड थोड़ा एक्सपेंसिव है, तो सिंपल नर्सिंग विल वर्क. आई थिंक इट्स अराउंड 4K or something. I'm not wrong. मतलब पहले तो वही था.
ओके.
Sorry, ma'am.
इसके नोट्स मैम
हाँ
हमारे
जी.
पास हैं, कैपलॉन और ये सॉन्डर के भी हैं, कैपलॉन के भी हैं, ATI के भी हैं और सिंपल नर्सिंग के
I'm telling you, don't go into theories, don't go into books,
यस
just do the questions. Just do the questions, read the rationales, same questions will repeat and same rationales will repeat. क्योंकि बहुत वास्ट टॉपिक है, बहुत वास्ट है नर्सिंग ना. यू कांट डू एवरीथिंग एंड रिमेम्बर
एग्जैक्टली
एवरीथिंग.
मैम.
यस
तो
मैम।
जस्ट डू द क्वेश्चंस, क्योंकि जो आएगा वो वैसा ही आएगा.
बस
सेम
मैम
टाइप
मैं
के
तो ये
क्वेश्चंस आएंगे.
समझता हूँ अगर अगर मैम हमारे कॉन्सेप्ट्स क्लियर हो ना, और प्रैक्टिकल जो आपने भी बात की है, प्रैक्टिकल तो मोस्ट इम्पोर्टेंट थिंग है, और अगर हम कॉन्सेप्चुअल
एंड
स्टडी करें तो थ्योरी हमें आसान लगेगी, वैसे थ्योरी याद करना बहुत मुश्किल है। तो आपकी
हाँ,
बात
आप
ठीक।
जैसे जैसे क्वेश्चंस करोगे ना आपको पता लगेगा, आप खुद ही एक्सपर्ट हो जाओगे. You'll
यस
get
मैम,
good at it on your own. You'll get to know कि okay,
इसी
they
वजह से
want
हम
this
लोग
type
कोशिश
of
कर रहे
answer.
हैं अपने हॉस्पिटल्स में भी रोटेशंस, जो डिपार्टमेंट हमसे रह गए हम कह रहे हैं उनको भी हम
हाँ,
क्लिनिकली जाके एक्सपोजर करें कि वी नो दैट व्हाट इज द
practicals are very
प्रोसीजर।
important. Yes,
यस मैम।
theory से कुछ नहीं आता है.
यस
I'll be very honest with you. मतलब we'll do the theory, but that also I'll try that we'll do on an NCLEX basis and not like we have done in schools and colleges, because that doesn't help. So these are the next generation NCLEX questions. ये भी आते हैं.
ओके.
So you can just study. The nurse is caring for a 45-year-old client in the emergency department. Clinic visit 2 weeks ago. 2 हफ्ते पहले क्या बोल रहे थे वो कि the client reports severe nausea, vomiting and diarrhea after recently eating undercooked chicken. The client is diagnosed with gastroenteritis. Then emergency department में आए हैं and they are saying the client has progressive ascending symmetric muscle weakness in both feet and legs. Muscle strength is 1/5 in bilateral lower extremities and 2/5 in bilateral upper extremities. Lower extremity deep tendon reflexes. जहाँ tendon reflexes आ गए और muscle reflexes आ गए, वहाँ question nervous system का बन गया. Reflexes are 0+8 symmetrical. So the nurse should monitor the client for which of the following findings?
2,
कुछ समझ आ
3,
रहा है?
मैम ब्लड प्रेशर वेरिएबिलिटी
2,
एंड
3,
रेस्पिरेटरी
4,
रेट
5.
इज रेस्पिरेटरी रेट एंड डेप्थ
और गेस्ट्रो.
Lost memory.
No.
It is also,
I'll go with 5
part of
because they
loss of
have vomiting and diarrhea, dehydration.
1, 2, 3. I think so.
Ma'am, I think
2 or 3, I don't know.
Asymmetry. I'll go with 4 and 5 too, ma'am.
I think all are right.
Okay, so what is the explanation? Pathogenesis of Guillain-Barré syndrome. किसी ने गेस किया था Guillain-Barré syndrome? जब बोला लोअर एक्सट्रीमिटी में डीप टेंडन रिफ्लेक्सेस नहीं हुआ है, Guillain-Barré syndrome कहाँ से शुरू होता है? नीचे से
yes, ma'am. Ma'am,
ऊपर,
you
है
know,
ना?
in previous class, ma'am told us that it is ascending weakness. There is a
Yes,
ascending weakness in
ascending.
Guillain-Barré.
Yes. So
5.
diagram तो चलो छोड़ो. This can read it. Guillain-Barré syndrome usually follows a respiratory.
Guillain-Barré syndrome.
Mute कर लो. I will read for you. Guillain-Barré syndrome usually follows a respiratory or gastrointestinal infection, like gastroenteritis से शुरू होता है, that triggers an immune response, okay, resulting in peripheral nerve inflammation. GBS is characterized by ascending symmetric muscle paralysis and areflexia, absence of reflexes. सबसे इनिशियल सिम्टम्स यही होते हैं उसके. मसल पैरालिसिस हो जाता है, डीप टेंडन रिफ्लेक्स नहीं फील होते हैं, रिफ्लेक्सेस ही नहीं फील होते हैं असेंडिंग ऑर्डर में. Then that can eventually progress to involve the thorax and cranial nerves. Nurses caring for clients with GBS should monitor what all should be monitored: blood pressure variability. Autonomic dysfunction is common in GBS and can cause blood pressure, heart rate instability, leading to hypotension, or dysrhythmias. Then decreased respiratory rate and depth. These occur when ascending muscle weakness progresses to the thorax. The nurse should monitor for signs of respiratory distress, capillary desaturation, hypoventilation, breathlessness while speaking, labored breathing, and be prepared for intubation if the client is unable to independently ventilate due to thoracic muscle paralysis. यहाँ तक तो वैसे आता नहीं है, मौका मिलता नहीं है, आ जाता है पेशेंट तब तक ICU. Difficulty swallowing. Paralysis and weaknesses of the cranial nerve make eating and swallowing difficult, increasing the risk for aspiration pneumonia. Urinary retention. This occurs secondary to autonomic dysfunction के सबसे पहले होता है. Clients with GBS may need temporary intermittent urinary catheterization. Memory loss is associated with neurological conditions such as dementia or brain injury. ये भी पढ़ लिया करो क्योंकि अगली बार ब्रेन इंजरी का क्वेश्चन आएगा और उसमें ऐसे पूछा जाएगा कि इसकी सिम्टम्स बताइए क्या है, तो उसमें मेमोरी लॉस आया होगा. ठीक है. Then Guillain-Barré syndrome is characterized by ascending symmetric muscle paralysis and areflexia. ये 3 चीजें याद रख लेना बस, आपकी नैया पार है. Okay. Next is ये भी है. The nurse is caring for a 40-year-old client. Nurses notes में क्या लिखा है पढ़ो. Prenatal अपना अपना म्यूट करके पढ़ो.
Ma'am, can you click on that arrow so that we can get some selection? No, I mean to the.
This. क्या मिला सबसे अच्छा आंसर? क्या होना चाहिए? What is she experiencing? Seizures आ गए हैं. Everything is done after 1 week. She is coming after 1 week.
Loss of consciousness and falling at.
Yeah, but it happened after 1 week.
Eclampsia.
Pardon? एक्लेम्सिया हो गया उसको एक
हो गया?
हफ्ते पहले।
ओके
एक हफ्ते पहले हो गया उसको दे दिया लेमोट्रिजिन वगैरह सब कुछ हो गया उसका। ये
ऑर्थोस्टेट
उसको
हाइपोटेंशन माइग्रेन हेडेक होगा मैम शायद।
एक्लेम्सिया के बाद क्या आता है? कोई भी सीजर्स के बाद क्या आता है? सीजर्स के 3 फेसेस होते हैं ना। हाँ, तो सीजर्स के बाद क्या आता है? एपिलेप्सी, पोस्ट एपिलेप्सी,
माइग्रेन।
post ictal. I mean, I think this should be the one. But
पोस्ट
what do you people want me to choose? Majority vote किसको जा रहे हैं? Eclampsia.
No, ma'am.
And should anticipate a prescription for. ये किसी ने अगर काम किया है वहाँ पे लेबर रूम बोल रही हूँ, midwifery, gynae ops में, they will know. But लेमोट्रिजिन इंडिया में यूज नहीं होता, बट होता यही है, तो इसके लिए फार्मा पढ़नी पड़ेगी। ठीक है, तो you can just read it. Preceding symptoms,
स्टडी वाले
fever or
क्वेश्चन तो
symptoms.
मैम थोड़ा टाइम लेते हैं क्योंकि इसको अंडरस्टैंड करने में थोड़ा टाइम लगता है, तो
हाँ
फिर
हाँ,
ही
मेरे
बंदा
को
जो
पता
है
है
डिसीजन मेकिंग कर सकता
आपके पास
है।
टाइम होगा नहीं वहाँ पे टाइम होगा नहीं आपके पास, आपको जल्दी जल्दी करना पड़ेगा
मेरा
तभी
ख्याल है
मैं
मैडम इनक्लेक्स में आप थोड़े क्वेश्चन करो, बट ये है कि विद रैशनल करो और समझ के करो, तो वो आपके लिए प्लस पॉइंट है। आप जल्दी करो और गलत करो, उससे आपको ज्यादा नेगेटिव मार्क होते हैं, क्योंकि वो कंप्यूटर जो है, जो मुझे लास्ट टीचर ने बताया था बकौल उनके, वो कह रहे थे आप थोड़ा करो लेकिन सही करो,
नहीं
कोशिश
नहीं,
करो।
बिल्कुल सही है, बिल्कुल सही है। बट मैं आपको वैसे सबके टाइप्स बता रही हूँ कैसे कैसे क्वेश्चंस हैं, तो आप अभी मतलब बस पढ़ लो ये थोड़ा,
Yes.
कि आपको आइडिया हो जाएगा
क्योंकि
क्वेश्चन
केस
का।
स्टडी जब आप सही अंडरस्टैंड करेंगे और तभी आप उसको अच्छे तरीके से वो कर पाएंगे, क्योंकि एक केस स्टडी में आई थिंक 4 to 5 क्वेश्चन होते हैं ना, 3 to 4 या 4 to 5।
एक स्टडी में मतलब मैं समझी नहीं आपका
केस
क्वेश्चन।
स्टडी एक आया तो उसमें से 5 to 6 क्वेश्चन तो आती हैं एक केस स्टडी में से ना,
हाँ 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 हाँ,
क्योंकि अगर आप
ये तो
अंडरस्टैंड सही करेंगे तभी आप 6 सही कर पाएंगे, वरना 6 के 6
वो
गलत
तो है,
होंगे। अगर
वो तो है, वो
अगर
तो है।
आपने नर्सिंग नोट सही आपने अंडरस्टैंड किया, देन ही आप परफॉर्म कर पाओगे।
And the best part is when you move to another question, you get to know the answer of the previous one, and then
बिल्कुल
you
बिल्कुल,
can't change it.
एग्जैक्ट ऐसे। First you
So
find a disease, after that you
that's the
can
most
science it,
regretting
and
part.
then you
I
can
remember.
perform.
Yeah. So you can just read it once. Okay. So lamotrigine is an anticonvulsant often prescribed to clients of childbearing potential with epilepsy due to the lower incidence of congenital abnormalities. As such, I have not seen lamotrigine used in India. But if anyone of you have seen it in the hospital, let me know. कौन सा hospital है वो? Okay. हमारे यहाँ पे नेफेडिपिन यूज करते हैं, एंड कभी कभी वो भी आ जाता है, एंड मैक्सेस तो है ही एपिलेप्सी के टाइम पे, मैक्सेस इंफ्यूशन। ओके, तो epilepsy due to lower incidence of congenital abnormalities when compared to the anticonvulsants. Free seizures, auras, blurred vision, tinnitus, nausea. आप जब क्वेश्चन पढ़ेंगे आपको पता होना चाहिए कि वो कौन सी स्टेज डिस्क्राइब कर रहे हैं। अब मैंने आपको यहाँ पे बताया कि इनिशियल प्रीनेटल क्लिनिक विजिट में जब आई थी वो क्लाइंट को कुछ नहीं हो रहा था, क्या हो रहा था, हाँ 13 वीक्स का जेस्टेशन था उसका। द क्लाइंट्स मेडिकल हिस्ट्री इंक्लूड्स एपिलेप्सी एंड माइग्रेन हेडेक, so she had epilepsy before. Okay, migraine headaches भी बोला है, so that's why some of the people were saying migraine headaches, right? Home medications are lamotrigine, but then you are seeing the medications. Lamotrigine is used, that is for anticonvulsants. Okay, then butal is barbitalol, so that is also used for convulsions, as far as I know. Yeah, and PCM ka combination, yes, so it's used for convulsions. So by medications, I got to know that it can be a side effect of epilepsy. So that's how you have to like process the question. Okay, because Mohan ne jaise bataya, you have to take time to analyze what is the situation, what can happen to this lady after 1 week. of having these medications. Okay, just think that way when you are reading the question. That's all I want to say. Okay, and have you people read it? Shall I move to the next question?
Sorry, ma'am. I just want to inform my shift is started. Can I leave the class?
Yeah, sure.
Thank
Sure.
you.
You can see the recording afterwards.
Okay,
You
ma'am.
want.
Thank you.
Okay.
आप इनक्लेक्स का एग्जाम ही लेंगे या लेक्चर्स भी हमारे फ्यूचर में कंडक्ट करेंगे?
आपके लेक्चर्स भी लूंगी मैं।
अच्छा, जस्ट आप मॉक टेस्ट कंडक्ट करेंगे?
नहीं, मैं आपके लेक्चर्स भी ले लूंगी। अभी आगे के कुछ लेक्चर्स मैं आपके ले लूंगी।
बस गायनी हमारा सबसे वीक मैम वो है, क्योंकि हमारा एक्सपोजर ही नहीं होता ना गायनी में।
गायनी
तो
ओके,
वो
तो
आपने हमें
गायनी का
पढ़ाना है।
हाँ जी, ठीक है ठीक है। गायनी क्या मैं आपको भी नेक्स्ट आई वाज थिंकिंग ऑफ डूइंग कार्डियोवैस्कुलर, बट इफ यू वांट गायनी वी कैन जस्ट डू गायनी डे आफ्टर टुमारो। टुमारो विल डिस्कस स्ट्रोक, क्योंकि स्ट्रोक से बहुत क्वेश्चंस आते हैं
ठीक हो
एंड आई बिलीव स्ट्रोक हैज नॉट बीन डन and
Stroke and
afterwards we can do
hydrocephalus.
hydrocephalus is just like a little brother to meningitis. If you have done
Meningitis.
meningitis you will get to know it.
Okay, ma'am.
सेम ही है ऑलमोस्ट, ज्यादा कोई डिफरेंस नहीं है। बस वो मेनिंजिस में होता है, वो कहीं पे भी हो जाता है, स्पाइनल कॉर्ड से लेके ऊपर तक, यही है डिफरेंस। ठीक है, मेनिंजाइटिस पढ़ा है ना?
Yes, ma'am.
हाँ, तो बस मेनिंजाइटिस कहाँ पे होता है, कहाँ पे होता है उसका इन्फ्लेमेशन?
Inflammation of the brain and spinal cord.
स्पाइनल कॉर्ड
Layers of the brain.
इस
हाँ, मेनिंजिस में होता है वो। हाँ,
मेनिंजेस में
कवरिंग
inflammation
लेयर
of
और उसके
meninges
बीच में, या वो कवरिंग लेयर बोल रहे थे ना, सबड्यूरल और वो तीन होती है ना।
Inflammation in the meninges.
यस, बट मेनिंजिस का भी वो तीन लेयर्स होता है ना, सबड्यूरल एंड दो और होती हैं व्हिच आई फॉरगॉट।
extradural
We'll just read tomorrow.
Pia matter, dura matter.
ड्यूरा मैटर, तो ड्यूरा मैटर का ही वो सारा मैटर बाहर आता है, तो वो
ब्रेन और स्पाइनल कॉर्ड में इंफॉर्मेशन नहीं होती।
स्पाइनल कॉर्ड वाले को हम हाइड्रोकेफेलस बोल देते हैं ना। ब्रेन मेनिंजिस तो ब्रेन में ही होता है, तभी तो वो मेनिंजाइटिस है ना। बाकी जगह और कहीं पे हो रहा है, स्पाइनल कॉर्ड में हो रहा है, कहीं हो रहा है, तो वो हाइड्रोकेफेलस हो गया।
Okay,
बट वील
okay.
स्टडी, नो वरी, वील स्टडी टुमारो। आई आल्सो फ्रेशन अप ना, मेरे इवन आई हैव नॉट सीन दैट टॉपिक हाइड्रोकेफेलस।
Option A, ma'am.
Okay, I did not read it. The client has increase in ICP with cerebral edema and mannitol is administered. Which assessment should the nurse make to evaluate if a complication from the mannitol is occurring? Mannitol हम fast देते हैं, क्यों fast देते हैं? Auscultate breath. Okay. Auscultate breath sound to assess for crackles. Monitor for more than 50 ml per hour urine output. Monitor glaucoma scale increasing from 8 to 9. That is a good sign. Press over the tibia to assess the fitting edema. बताइए क्या करेंगे?
Yes, ma'am. First option, auscultate breath sound to assess crackle.
फोर्थ नहीं लग रहा?
थर्ड वन
हो गया आपको। थर्ड वन कैसे होगा? वो तो 8 से 9 हुआ, इट्स अ गुड थिंग।
मैम मुझे वो मैं अपने ऐसे बता रहा हूँ, कोई कंफर्म नहीं बता रहा। मैं अपने उससे अगर पेशेंट का कॉन्शियस लेवल वो है, मतलब सीजर आ रहे हैं,
सेकंड
प्रेशर बढ़ गया, तो उस कंडीशन में हम उसको कम करने के लिए मिनिटाल देते हैं कि वो कम हो, तो जिसे जब वो हाई होगा तो उसका मेंटल स्टेटस भी
No. Mannitol is not at all given for that. Mannitol is given to decrease your ICP and increase your consciousness. हाँ, तो आपका consciousness बढ़ेगा ना जैसे जैसे आप ठीक होंगे।
यस, बस मैंने तो अपने उससे बताया था।
हाँ, you just read this once. ऑस्मोटिक डाययूरेटिक होता है, क्या करता है? सेरेब्रल एडेमा को कम करता है। सेरेब्रल एडेमा कम होगा तो आईसीपी, ब्रेन पे प्रेशर अपने आप कम हो जाएगा। ठीक है, एंड एक्यूट ग्लाकोमा के लिए भी यूज होता है, जिन्हें हमने कभी किया नहीं। When administered, mannitol causes an increase in plasma oncotic pressure that draws free water from the extravascular space into the intravascular space. वही osmosis कर दिया उसने, creating a volume expansion. This fluid, along with the drug, is excreted through the kidneys, thereby reducing cerebral edema and intracranial pressure. Okay, however, if a high dose of mannitol is given or it accumulates, as in kidney disease, Okay. Fluid overload that may cause life-threatening pulmonary edema results. Okay. So patients
That's
with
right.
kidney disease जिनसे मैनिटोल निकलवाया नहीं जा रहा है, बॉडी से निकल नहीं रहा है, तो वो बॉडी में एक्यूमुलेट होगा, और बॉडी में एक्यूमुलेट होगा सबसे पहले अपने लंग्स जाएंगे, पल्मोनरी एडिमा हो जाएगा. ठीक है. तो जिसने भी बोला था फर्स्ट बहुत सही बोला था, हमें बीच बीच में उसके साउंड्स क्रैकल्स assess for crackle sounds. And this mainly happens in stroke के पेशेंट्स में मैंने देखा है सबसे ज्यादा पल्मोनरी एडिमा होते हैं. बाकी सब तो फिर भी थोड़े हिलते फिरते हैं. स्ट्रोक के पेशेंट्स और ये याद आ रहा है अभी तुमको, स्ट्रोक ही होता है मेन. तो ग्लूकोमा वगैरह को तो कभी नहीं होता. फिर इसके ऑप्शंस, यूरिन आउटपुट would be expected to increase from the diuretic effect of mannitol. This is not a complication. Then Glasgow Coma scale scores range from 3 to 15. Okay, so 8 से ऊपर तो अच्छा ही होता है. Improved mental status is a desired effect of treatment. Okay? The presence of crackles is a more sensitive sign of fluid overload than pedal edema. Pedal edema तो उसको है तभी तो हम दे रहे हैं. तो pedal edema कम हो ज्यादा हो लेकिन रहेगा, वो कुछ कुछ डोसेस के बाद वो थोड़ा जाना स्टार्ट होगा. ठीक है. Furthermore, in a bedridden client, the assessment should take place at a dependent part of the body, usually the sacral area. Okay. तो वही मैं बोल रही थी, स्ट्रोक के जो पेशेंट्स होते हैं उनका असेसमेंट, जो लॉन्ग टर्म स्ट्रोक के पेशेंट होते हैं उनका असेसमेंट आप पैरों से कैसे कर सकते हो, क्योंकि उनका पिटिंग एडिमा तो हो जाता है एक हफ्ते बाद. तो यू हैव टू लुक एट दी सेक्रल रीजन, हिप्स वाली साइड पे ना, हिप्स के पीछे. कैन आई मूव टू द नेक्स्ट क्वेश्चन? स्पाइनल कॉर्ड इंजरी बहुत आता है, इसके क्वेश्चंस कर लेना, उसमें है जो मैं मॉक टेस्ट अभी दूंगी उसमें है. ठीक है. A client with a C3 spinal cord injury has a headache and nausea. The client's blood pressure is 170 by 100. How should the nurse respond initially? पहला स्टेप क्या होगा? Initially का मतलब वो है, कभी कभी होगा कि करना ये सब होगा, तो you'll get confused. तो पहला स्टेप क्या होना चाहिए? पहले क्या करे सबसे?
When blood pressure increases to antihypertensive medication.
पहला स्टेप क्या करोगे? आपने पेशेंट देखा है अभी जस्ट, आपको पहला स्टेप करना है.
नंबर 4 मैम.
मैम उसकी पोजीशन सही करेंगे, उसकी राइट
Yes.
पोजीशन.
ये भी नहीं है. Palpate the client's bladder. पहले हम क्लाइंट का ब्लैडर चेक करें. हाँ, C3 इनका होता है ना कि डायफ्राम से नीचे कौन सा था यार वो, इंजरीज अबव T6. हाँ. Autonomic dyslexia is an acute life-threatening response to noxious stimuli which clients with spinal cord injuries above T6 are unable to feel. T6 से ऊपर वालों को यूरिन का पता नहीं लगता, ब्लैडर का पता नहीं लगता, ऑटोनॉमिक डिसलेक्सिया हो जाता है. ये लिख लो, इससे बहुत क्वेश्चंस आते हैं कि T6 से अबव वालों का क्या होता है, T6 से बिलो वालों का क्या होता है. यू कैन जस्ट क्लिक अ पिक्चर इफ यू वांट.
मैडम
क्लिक अ
काइंडली
पिक्चर.
ये रिपीट करिएगा.
आपकी स्पाइनल कॉर्ड होती है, तो सबसे नीचे क्या होता है, कैसे शुरू होती है, कहाँ से कहाँ तक है, ऊपर टी से. आपने पढ़ा होगा ना
मैडम
स्पाइनल
ये
कॉर्ड का एनाटॉमी.
जी जी
हाँ, तो स्पाइनल कॉर्ड का एनाटॉमी बताइए एक बार. स्पाइनल कॉर्ड का एनाटॉमी
मैडम
बताओ, कोई तो बताओ.
मैडम ये हमारे पास सी से स्टार्ट होता
मुझे बस बताओ सी कितना है, एल कितना है, टी कितना है, एस कितना है.
Ma'am, C6,
मैम
T12,
सब देख कर बता दें, अब
नहीं
किसी को नहीं याद.
नहीं C6, T12 और sacral 5,
5 lumbar 5 sacral
number
1.
5,
C8,
L1.
C8, T12, L5, S5, C1.
इसको रट लो, इसको रट लो, जब तक एग्जाम भी क्लियर हो रहा, जस्ट मेमोराइज इट लाइक एनीथिंग. because there are questions going to come from this. Okay, so once you get to know the position, T6 is somewhere around or below diaphragm. तो वही ये बोल रहा है कि ऑटोनॉमिक डिसडिस्लेक्सिया हो जाता है, तो वो कब होता है जब तुम्हारी T6 से ऊपर की कोई इंजरी होती है, समझ रहे हो?
Sorry
T6
for
से ऊपर की कोई होगी.
Sorry for
Yeah.
interrupt, ma'am. Ma'am, can you please explain in English, ma'am?
Oh, I'm sorry. Yeah, so I was just saying that if you get an injury above T6 level, I'm just explaining them in Hindi because they are not able to, like, they are more comfortable in that. But I'm just explaining the thing which is written in the left side. Okay, so you can read it. I'm explaining the same thing. Okay, that autonomic dyslexia is an acute, life-threatening response to noxious stimuli, which clients with spinal cord injuries above T6 are unable to feel. So this client has been experiencing a D spinal cord injury. C3 is somewhere near cervical. Okay, so he won't be able to feel the lower body ka reflexes. That's what I'm saying. So that's why they are saying to palpate the client's bladder to see if he's full or not. Because even if he's full, he won't be able to tell you he's not feeling anything. So he'll just pass the urine anyway. The muscles are also loosened, so he won't be able to control it or do something, and he'll spoil the bed sheet. So that's why first of all, she palpated the client's bladder. That's all. Also, this is applicable to fecal impaction and tight clothing. If you are making the client wear a tight legging, he will not be able to feel it, and there may be any, like, I don't know, the shoelaces and waistbands, yeah. So maybe even if they are tight or something, they won't be able to tell you. That's all. You can just read this once. So, unable to feel. Signs and symptoms include hypertension, bradycardia, pounding, headache, diaphoresis, and nausea. It is essential that the nurse assess for and remove noxious stimuli to prevent a stroke. Okay. So if he is not able to pass the urine or something, he will not be able to tell you, or maybe he won't even pass it. So this may have some pressure on the nerves, which can in future cause increased ICP or something. That's why it is increased hypertension. So stroke is a risk. Then hypertension, headache, and nausea due to uncontrolled sympathetic activity will resolve once the cause is identified and removed. Lowering the head of the bed would increase blood pressure. Okay. The head of the bed should be raised to lower the blood pressure. So, in what case will we lower the bed?
When the blood
There's only
pressure
one case in
is
which
low.
Hypotension.
And hypotension is most common in which case? Shock. Okay?
Shock. Yeah.
Yeah. Shock is the only thing that you'll give Trendelberg or just supine position. Okay. The nurse is teaching a client who had a partial laryngectomy and sustained damage to the ninth cranial nerve. Which of the following information should the nurse include? What do you think is the most appropriate answer to this? Diagnosis affected and you will need. Any idea? Ninth cranial nerve का क्या function है? What is the function of ninth cranial nerve? Which one is the ninth cranial nerve?
Gasopharyngeal.
So what does it do? Which one did you say?
Glossopharyngeal.
Okay.
So ma'am, fourth one.
Fourth one to ठीक है, but your balance. Okay. So gas
Madam,
reflex has
ninth one is
been
The
answered.
last, ma'am,
glossopharyngeal nerve, which help.
the fourth one is answer, ma'am.
Yes.
Okay. Sure? Okay.
Sure.
Here are our things. Gas reflex is responsible for, glossopharyngeal is responsible for gas
Glossopharyngeal.
reflex. Okay. So once we should just revise all the nerves. Huh? We'll be getting this in future. So olfactory is responsible for smell test. Smelling, yeah. Optic is responsible for visual activity and visual fields. Oculomotor is responsible for pupil constriction and extraocular movements. Trochlear is responsible for extraocular movements. Inferior adduction. Okay. Inferior adduction is adduction and flexion. Adduction. What is adduction? Extraocular adduction. Okay, ठीक है. Trochlear is responsible for extraocular movements, inferior adduction, trigeminal, clenched teeth, closed eyes, light touch to face, abducens, extraocular movements, lateral abduction. पढ़ लिया? Done? You can just take a 10 minutes break if you want. After this, if you have read it. There is a mnemonic also written in the end. If you don't have your own, you can just write that one. पढ़ रहे हो क्या? Just give me a heads up.
Yes, ma'am.
Answer. Okay. Sure. If you want me to scroll down, just let me know.
Ma'am, please scroll.
Affects the gas reflex, ability to swallow, phonation, and taste. Clients who have had a partial laryngectomy should be assessed to the ability to swallow safely and effectively. See, they're asking it so smartly. First, they are telling you that some procedure has been done, and then they're asking which nerve can be affected from this procedure. ऐसे ऐसे करके they'll ask.
That's why it's NCLEX.
Yeah, it's quite stressful to be honest. But it's just 1 month of stress, and then you're free if you do 60 questions every day. Shall I move to the next question, or do you want a break?
And how many questions every day?
Abhi tak to you have only done 15. But rest I'll give you in your mock test.
No, you said that we can clear it in 1 month.
Actually, I'll give
15.
you I'll give you a video of this recording of this session, because what is important is the rationales. The same rationales will be applied and questions will be formed from the same rationale. Okay, the material is same, only the questions will be different. In NCLEX also this happens. They'll give the same question with some other disease condition or something. That's how they do it. So basically, you just have to know that what is the format, and then you can guess the answer.
It's all about doing questions. Do what?
We'll just take a 10 minutes gap, break,
Yes,
if you
ma'am.
don't mind.
Yes,
Okay.
ma'am.
We need a stage break.
The stage is open. If anyone wants to read this or any previous questions, just let me know. I can just replay it. Okay, so everyone's back.
Yes, ma'am.
Let's see the next question till then. The nurse is caring for a client who had transsphenoidal hypophyseectomy, which we have not read, but then undeveloped diabetes insipidus. Which of the following findings would the nurse expect to observe? Transsphenoidal hypophyseectomy. Transsphenoidal. Any idea?
I think here is just they are just asking for diabetes insipidus, signs symptoms.
Excessive thrust.
It's surgery, removal of tumor,
Increase urine output.
pituitary gland.
Someone has said it very accurately, but what are the symptoms then? What does
Increase.
pituitary gland do?
Yeah.
What about the electrolytes, osmolarity?
Diabetes. Sodium level decrease, ma'am.
I don't know. I'll just check it for you.
Increasing urine output,
1, 2,
and
and 4.
increasing sodium osmolarity, then decreasing sodium level.
Serum also.
Okay. So what is it exactly? It's the surgical removal of pituitary gland. Very good. An endocrine gland that produces, stores, and excretes hormones. So antidiuretic hormone हो गया, ADH, growth hormone, adrenocorticotropic hormone. Clients undergoing hypophyseectomies are at risk for developing neurogenic diabetes insipidus, which is very, very rare. A metabolic disorder of low ADH levels. ADH promotes water reabsorption in the kidneys. There are very small surgical and medical procedures in NCLEX, like from which you can get 1 or 2 questions. This is one of those. So just go through it. Just diabetes symptoms, so they have told. Okay. Clients with DI experience hypernatremia. Electrolytes will get disrupted, but will be hyper, not hypo. Should I go to the next question? No? You can read it later on also in the recording if you are comfortable with that. We've just covered 15 questions. Like, it's better if you do the questions first. Then you can give the mock test also, no?
Yes, ma'am.
Okay. So the nurse is planning. Don't worry if they're getting wrong. As long as you'll practice, and as many as you'll practice, you'll get to know more about the question formation, and you'll get it corrected next time. Okay. The nurse is planning care for a client with suspected ischemic stroke who has just arrived at the emergency department with slurred speech, facial drooping, and right arm weakness that began 1 hour ago. Which of the following interventions should the nurse anticipate, including in the initial plan of care? Golden hour, 1 hour.
Ma'am, perform a
be done?
baseline neurologic assessment. Fourth one.
What about the fifth one?
Initiate anti-lapse with the next 3.5 hours.
What about the third one?
Starts. Yes, ma'am.
Yes.
Okay, yeah. That's all. Ischemic stroke, you all know. So, how does stroke occur? What is stroke? Very easy. Everyone must have seen once or twice in their life while working in ICU. You know? So,
Yes.
what happens in stroke? This is given. See.
Hemorrhage हो जाता है, bleeding,
formation.
heavy bleeding.
Heavy bleeding is one type of stroke. It is hemorrhagic stroke. Okay, there is bleeding, there is leak somewhere, and then the clot is formed, and then the clot blocks the way for the circulation, and then stroke occurs. Okay, the other one is ischemic, which happens because of the arteries get depleted. Like there is cholesterol formation, cholesterol lumps and all that is formed in the walls of the arteries. So it gets very narrowed, and sometimes lumps are formed because of that only, or there is a blockage. Okay, so ischemic stroke occurs when circulation to parts of the brain is interrupted by occlusion of cerebral blood vessels by thrombosis or embolus. और embolus कैसे बनता है? Embolus is made. Have you seen like have you seen any case in which air enters the veins and patient discovers stroke because of air embolism? I've seen one such case in which what happened was the air entered through this thing. There was a very misunderstanding me. It was a very unethical thing to do. That the blood bag was connected to the patient, and the blood bag got emptied, and after that, air also got in the veins of the patient. And normally nothing happens, but in his case, he developed a case of air embolism, and then that the embolism went to the brain, and it caused stroke. So you should be very cautious with that. That was an example of ischemic stroke. But the other one is hemorrhagic stroke, which occurs when a cerebral blood vessel ruptures and bleeds into the cranial walls. Both types of stroke result in the brain tissue death without prompt treatment. So जब ये हो जाता है, then the brain deprived of blood. Of course, there is no blood passage, so the brain will get deprived of blood, and that part of brain will die without blood. Okay. So iska emergency management is a client with stroke symptoms must have an immediate CT scan or MRI of the head to determine the type and location of the stroke. Then determining exactly when symptoms began is essential for diagnosis and planning treatment. That's why history taking is very important. That what happened, when did the patient go to the bathroom? These are the initial questions we ask. Okay, when did you find the patient lying down on the floor? When did he go to the washroom? Maybe there is one question in which they'll ask that what are the initial questions you asked the family member or whoever brought him, that what happened. Okay, so just read this. It must be administered. Okay, atypical. Okay, so elective place is to be given in the golden hour, which we'll study tomorrow. It must be administered within 4.5 hours from onset of symptoms. A baseline neurological assessment is done, essential for tracking ongoing neurological symptoms that indicate improvement or complication, which guide later treatment. Okay, I'm going to the next question. The nurse assesses a newly admitted adult client on a neurological inpatient unit. Which assessment finding require immediate follow-up by the nurse? Newly admitted client with neurological inpatient unit. Okay. This is a newly admitted adult client.
Ma'am, second
Mm-hmm.
or fifth?
Eyes move in opposite direction of the head. Okay. Which one? Fifth.
Yes.
Toes point downwards when sole of foot is stimulated.
Set of right arm drift.
और कुछ?
Neurologic inpatient.
Cannot flex the chin towards the chest. Okay.
But ma'am, इससे neurologic का
Meningitis का होता है ये. This is a sign of meningitis, I guess. Brzezinski.
and ma'am,
Okay.
what about pupil 8 millimeter in diameter?
We'll
Pilot.
just see. We'll just see. Okay, those two were wrong. So yeah, the first one is the sign of meningitis, if I'm not wrong. Anyways, yeah, so we can just see this. Nurse performs a neurological assessment to evaluate the changes in motor and sensory functions by assessing pupils, cranial nerves, and neuromuscular functioning. The neck should be supple and able to be flexed toward the chest. Natural rigidity requires follow-up due to possible meningeal irritation related to infection. Okay, why meningitis? Option 1. See, meningitis has two ways to get identified. One is Brzezinski and the other one is K से उसका नाम, I guess. Starts with K. There are two signs, right?
Yes, ma'am. Bruising, sorry.
And which is the other one in which you upraise
Flexion
the
of
legs
legs.
perpendicular to the thighs, yeah? So उसमें तुम flex करके you'll see if the patient is having pain in the hamstring region.
परसों ही पढ़ा था.
Then why are you people not answering? Okay, so
Man,
you can read the other options too. Which one was wrong? Second was wrong, no? So oculocephalic reflex, doll's eyes, is a sign of death, right? Is an expected finding indicating an intact brainstem. It is tested by rotating the head and watching for the eyes to move simultaneously.
Turning sign.
Yes, curling sign. So the test is not performed if spinal trauma is suspected. Okay, neurological assessment you will not do oculocephalic reflex because it can cause spinal trauma and we don't know what trauma this patient has come with. Okay, it is important, just read it once. The normal finding in adults is an absent Babinski's reflex. Babinski's reflex is the one, this one, first one, I guess. The presence of Babinski reflex is, that is, toes fan outward and upward with stimuli. Toes fan out. Okay. Babinski is in children. I'm sorry. Babinski is the one in which you put something on the sole and the sole flexes, sole of the feet flexes. Remember, in neonates you do it. It is one of the neonatal reflexes. So it goes away after 1 year. So after that, the person should not be having a Babinski reflex. That is a normal finding. So the normal finding in adults is an absent Babinski reflex. You should not have Babinski reflex in adults. The presence of Babinski reflex is expected in infants up to age 1, but in an adult may indicate a brain or spinal cord lesion. Okay. So next question is, oh, this is the one. I hate these questions. If you can read it.
Is it drag and drop?
Yeah. You have to drag and drop. Whatever you will tell me, I'll just drag it and drop. First, you have to read the history and physical assessment, sorry. Nurse is caring for a 38-year-old client. Okay, what are the findings? The eye open only to painful stimuli. Speech is incomprehensible.
Ma'am, vital signs.
GCS is 8. Vitals are 98.6, 92, 148, 82. S1 and S2 are heard. Peripheral pulses are 2 plus.
Present.
Vitals are not that bad, to be honest. The
Yes.
head of the right humerus is outside the shoulder socket. Outside the shoulder socket.
Right extremity findings. Pupil assessment and laceration of the shoulder.
GCS score.
GCS, laceration of the laceration.
There is a laceration on the right shoulder that is 3 inches.
We'll get to know the answer later. Next question is, for each characteristic below, click to
Ma'am, what is the
specify.
answer?
You'll get to know once you complete all 6 of them. It's a bunch of 6 questions.
Okay.
You can't change the answer. In other questions, you can change the answer by going to the previous question. But these questions, you can't go to the previous question. If you have fixed one question, you may get the answer in the second question. So they don't allow you to go back.
And what kind of question is this, ma'am?
These are called case study questions, as someone mentioned earlier, that there's a pack of 6 questions. No? This is the one. These are called case study questions. So it will be based on one particular case. So you'll get 5, 6 questions on that. But they all are counted as different questions. So tell me.
It looks like a
Okay.
same
So basically what they're asking is, what are the signs and symptoms of epidural hematoma and what are the signs and symptoms of subdural hematoma, which is a very close guess, to be honest. So you can just make a guess right now, but you can study it later. Epidural hematoma and subdural hematoma.
Ma'am, epidural is arterial bleeding.
Which one?
Epidural
Vomiting
is
तो दोनों में ही
arterial.
होगा.
Epidural is arterial.
Arterial.
Subdural. Vomiting is subdural hematoma.
Yes. You don't think epidural में there will be vomiting? Up to you. I don't know. Tell me the answer. Headache? जहाँ vomiting होगा, headache will also be there.
Yes, ma'am.
Yes.
They go along together. Then hemorrhage between the durameter and the skull. Hemorrhage, durameter. So if there is subdural hematoma, so there must be a leak. So if there is a leak, then hemorrhage between durameter and skull, can it happen or not?
Epidural.
Epidural होगा, ma'am.
Initial unconsciousness, brief lucidity, then decreased level of consciousness.
Epidural.
Subdural.
Everything is epidural. Okay, we'll do both. Get to know the answers later. Then the nurse has reviewed the information from the diagnostic results. The nurse is monitoring the client for increased ICP. For each finding, click to specify whether the finding is expected or not expected with increased ICP. So increased ICP, bradycardia, expected, not expected.
Expected bradycardia.
Restlessness.
Expected.
Irregular respiration.
Expected.
Everything is Unilateral,
Unilateral
pupil
pupil
dilation.
non-expected. Widening pulse pressure. I think it's expected.
Wedding pulse expected, ma'am.
Fixed and pronated arms.
Expected.
Not expected. Pupil constriction
think-
with increased light.
By the way,
Unilateral pupil.
meningitis will also cause increase in ICP. So you can just remember the signs and symptoms of meningitis and correlate.
Ma'am, unilateral pupil dilation, I think it is expected.
That is up to you. Everything is expected. Pupil constriction with increased
Non-expected.
light. Next is, for each potential intervention, click to specify if the intervention is indicated or not indicated for the care of the client. So you can see now what type of questions are there. You rarely get asked for the pathophysiology and what is the disease condition in brief. You just need to know all the disease conditions, their definitions, and nurses' intervention, and their signs and symptoms. This is the basics. Okay. So tell me. Okay.
Negated.
Hypotonic solution. Hypotonic is? What is hypotonic? RL, NS, or DNS?
Not, ma'am, not indicated, I think so.
But what is hypotonic?
Hypertonic plasma phrase, plasma or this kind of fluid when we are giving to the patient, that is called hypertonic.
Not indicated.
Right.
Not
Not
indicated.
Not indicated.
Next, prepare for
Prepare
ETU
for
intubation.
intubation.
You know, we did study about
Indicated.
ET
No, ma'am,
intubation.
It's up to the
in
condition.
vaccines. But we did study about ET intubation earlier in the rationales. In some other rationales.
Yes, indicated, ma'am. You can say that indicated.
I don't know. I mean, okay, there is also a diagnostic result given.
Indicated.
So you can read this also. Linear fractures of the temporal and parietal bones and multiple. Unka CT was done now in the first question. So now the diagnostic result has come. It's a case study, right? So read the CT scan and then you can assess better.
They all are indicated. Indicated.
No cervical spine fracture is there or dislocation is present. Epidural hematoma is present. Linear fractures of the temporal and parietal bones are present. Multiple frontal, parietal, and temporal lobe contusions. So what should I do? ET tube, yes or no? Yes, you can.
Indicated.
In this case, it should not be indicated. I mean, not necessarily as such, but let's see. Okay, so nothing new is given. The head of the diagnostic, maybe everything is okay. So the nurse is developing a plan of care for the client following right-sided craniotomy, craniectomy. Drag the appropriate postoperative interventions that the nurse should include to the box to the right. Appropriate postoperative interventions, what all should I include? Monitor the client for polyuria, yes or no?
Manage pain and short acting, avoid analgesic, yes, ma'am. Second one.
Manage pain with short-acting opioid analgesic. Opioid.
Access the surgical side dressing.
Since the surgical
Coherence around range.
yes, ma'am. Alternate right.
The triangle position between the right and the left.
No,
Yes.
ma'am. Right, left, not. Place a sign above
Place.
the blind pad indicate there is no right.
He has underwent a
I think, ma'am.
right-sided craniotomy. So I don't think this is important
Yes.
or suitable.
Place a sign
Place a
above.
sign above
Right.
the client's bed indicating there is no right cranial bone flap. Yes or no?
I think, ma'am, there is a two correct answer: manage pain and short acting
Place a sign above.
opioid, and assess the
So
surgical.
I think now it's done. Now it's done.
Yes, ma'am.
The nurse has reviewed the information from the nurse's notes. Complete the following sentence by choosing from the list of options. The nurse suspects the client is experiencing. Nurse's notes are there. The client developed fever, headache, and vomiting 7th day of craniectomy. Overnight, the client is awake and confused. The client winces when prompted to move the head, and the hips and knees flex when the neck is flexed. Okay. So he has developed some sort of infection. What is this? What can it be? So
Meningitis,
you have
ma'am.
read this, yeah. And should anticipate
Mannitol. Administer the
and
mannitol therapy.
that's all? Are you sure?
Mannitol. Administering the IV mannitol.
Antibiotic.
Meningitis is itis. Itis is what? Infection.
Antibiotic, ma'am.
So
Inflammation of meninges.
for infection,
we
what
should
do you
go
have
for
to
antibiotics, ma'am.
do? Antibiotic therapy will be a priority.
Yes, ma'am.
And once that is cleared, you don't need to give mannitol afterwards, huh? If it gets better with that. So, okay, we should just revise this once. What is durameter? What is arachnoid? And what is pyometer? These were the three things I was confused in. So, meningitis is an infection that causes inflammation to the membranes covering the brain and spinal cord, the meninges. The combination of these three are called meninges. You must have studied. Okay. This is a rare life-threatening complication of neurosurgery. Inflammation and bacterial growth within the meninges lead to increased CSF volume and increased ICP. Without intervention, increased ICP may lead to nerve ischemia and permanent functional impairment or brain herniation and death. The initial priority is protecting other clients and staff from exposure because bacterial meningitis is highly contagious. Once the client is isolated, diagnostic testing, example lumbar puncture, blood cultures is performed, and broad spectrum antibiotics, ceftriaxone, vancomycin are initiated. Antibiotic administration should, ये सब याद कर लो, please learn these things, that which antibiotics are preferred according to NCLEX, because they will be giving a question based on this also. That what are the, in pharma, they will give this question. For meningitis, what is the priority to be given? So then you have to choose. So ceftriaxone and vancomycin are the priorities. And because it is highly contagious, we have to give antibiotic therapy first, and then we have to see about, after shifting the patient, we have to look for decreasing the ICP. So as someone said, that mannitol should also be administered later. Okay. Then, okay, incorrect. Hydrocephalus results in the buildup of CSF in the brain and can someone was asking now, what is hydrocephalus? See, it is just like a brother to meningitis. You can read it. Even the symptoms are not that different. Treatments include, okay, treatment is different. Ventriculoperitoneal shunt placement. Hydrocephalus will, what is the treatment for hydrocephalus? ventriculoperitoneal shunt placement to drain excess CSF from the brain. Okay. Brain herniation occurs when a rapid increase in ICP leads to protrusion of portions of the brain through openings into adjacent structures. Clinical manifestations include Cushing triad, bradycardia. Cushing triad. Learn this word. It will come in other questions also. Cushing triad is bradycardia, irregular respiration, hypertension with widening this pulse pressure. Bounding pulse, जिसको कहते हैं. Widening pulse pressure. Treatment includes osmotic agents, which is mannitol, to reduce ICP, or surgical intervention if not worked. Okay. So we should also see the previous question. Everyone is clear on that now?
Yes, ma'am.
So, okay. So these were also to be included. We just included 2 of those, the answers, which were correct. So you just get half the marks.
Half the mark.
No, I told you, but you didn't.
Oh, I'm so sorry. Monitor the client for polyuria. Place a sign above the client's bed indicating there is no right cranial bone flap. So, craniectomy, this is the picture. Portion of the skull removed to decrease intracranial pressure. Okay. This is quite.
Yes, ma'am.
Yeah. Craniectomy is a surgical intervention performed to decrease ICP. During the procedure, a portion of the skull is removed and the scalp is closed over the site, leaving a portion of the brain without overlying bone. This allows the brain to expand without increasing ICP. Appropriate postoperative interventions include monitoring for polyuria. Damage to the hypothalamus and pituitary gland from increased ICP can result in diabetic insipidus, which we read earlier, right? Yeah, I told you, all the questions are interrelated. So always read the rationale and you'll get to answer further questions. Yeah. So it is important to monitor for signs of increased ICP even after craniectomy is performed, because the surgical intervention is not always successful. Managing pain with short-acting opioid analgesics, a change in level of consciousness due to opioid administration could be misinterpreted as a complication of craniectomy. Okay. I'll get back to you with some tips and tricks, like what does NCLEX never approve of? There will be some options like opioids in treatment. NCLEX doesn't approve that. Maybe it is not the first line of treatment in foreign countries. So they don't. Whenever it is opioid, they will never consider it a right option. I don't know why. Maybe short-acting opioids, but long-acting opioids they don't consider. So you just have to see if it's short-acting or long-acting. Okay.
Okay.
So next is assessing the surgical site, testing for halo around drainage. Halo means draining, excessive draining. Clear to yellowish ring appearing around a spot of blood on gauze. What does that mean? CSF leakage. Indicate a cerebrospinal fluid leak from an intraoperative dural injury. A CSF leak increases the risk of meningitis. CSF leak hoga agar to, you will be more in risk for meningitis. Okay. Placing a sign above the client's bed indicating there is no right cranial bone flap, because the surgery has been done in the right side, so there will not be any right cranial bone flap. This is common sense. Okay. Previous question. All are right.
No.
Okay. So what was saying? Hypotonic solution. Yeah, someone said this very accurately. And rest all we'll do. Indicated interventions for clients with increased ICP. Monitoring temperature, preparing for ET, calculating cerebral perfusion pressure, to calculate the amount of blood flow circulating through cerebral tissue to prevent ischemia. Okay. To prevent ischemia, we do this, and elevating the head of the bed 30 degrees. Bed to you cannot give a supine position. Semi-fowler B, I think we prefer 60 degrees. Like we used to prefer that in our hospital, but 30 degrees is also fine. Administering a hyperonic solution IV would increase cerebral edema and is not indicated for clients with increased ICP. Okay. So yeah, so I was telling you now, flexed and pronated arm. Why is this wrong? It will again be related to increased ICP if I'm not wrong. Yeah. Flexed and pronated arms decorticate limb posturing is characterized by arm rigidity flexed at the elbow, hands raised to the chest, and legs extended. The posturing suggests worsening cerebral impairment, increased ICP, brain herniation. Whenever neurological assessment is considered, flexion and abduction, it will always be related to increased or decreased ICP. So just click it, take it on. The rest all were right. So do you want to read this or shall I move to the previous question? Okay. You can just check the answers. It's were wrong. Okay, vomiting and headache. Either bhi hota. Epidural hematoma. All were the symptoms of epidural hematoma, but only 2 were the symptoms of subdural hematoma. Okay. Now you can just read the difference. Epidural hematoma is most commonly caused by the arterial bleeding, tearing of the middle, something resulting in accumulation of blood between the durameter and the skull. Subdural hematoma occurs when a traumatic head injury causes venous tearing and bleeding into the subdural spaces between the durameter and the arachnoid meter. So this is between the durameter and the skull, and this is between the durameter and the arachnoid meter. As the hematoma expands, it increases the ICP. You can just read it. That was the main difference. Once we are done, I think this is pretty much like a summary to what type of questions come in the NCLEX. I'll just provide you the links to the mock test. Okay. Can I stop sharing? I think it's done. Time is over.
Yes.
Yes.
Was someone reading? Okay,
No,
so
ma'am.
I'll just provide you the link. And you can just ask me if any doubt, or if you want to do any extra topic tomorrow. Do you want to practice mock test only tomorrow, or shall we like start with stroke? What do you want to do tomorrow?
Firstly, you give us a few topics and you elaborate a few topics. After that, when you took exams, so that is good for us, I think so.
Okay.
Hello, can you hear me?
Yeah. I heard you. Okay.
Ma'am, the link will be shared on WhatsApp or here?
No, I'm sharing it here only. Let me see. OneDrive. Yes. Can you people open it? Just check it once if you can open it. These are one with the answer, and there is another link.
Yes, ma'am, open.
Okay. Copy.
How to save the
This is the one. You can just copy the link in your Chrome or anywhere. You can copy both the links and save it.
Yes, I have copied.
Okay.
Yes, ma'am.
So you can practice at home. These are just neurological, nervous system questions. So if you don't get anything, we can discuss it tomorrow. Anyhow,
Madam,
I've
just
written
show
the
the one more time that link.
Which one?
Link. That question has link.
Yeah, I've given both the links.
Yeah,
Is
okay,
it
okay,
not?
okay. Thank you. I got it.
Okay. So you can just try it once. If it doesn't open, just contact me once or in the group, and I'll give you a PDF. Then I have to make the PDF actually. Okay. So we'll just round up the class.
Ma'am, will you share this link in a group?
Yeah. I'll give it to Sumit and he'll share it. Okay. So the people are very much allowed to use
Welcome.
now.
Thank you. Thank you
ma'am.
so much, madam. Thank you.
Thank you so much, ma'am.
Thank you,
Thank you
madam.
so much, ma'am.
Pleasure.
It was a great session, ma'am. Today
It was
you
just a mock
expressed
test.
a lot of
We'll see.
skills.
मैडम टुडे वाज माय फर्स्ट डे और आते ही एक मॉकअप टेस्ट था so it was so confusing for
No,
me.
because I was told it was my first day also. It was my
Okay,
first day so I was told that the nervous system has been completed, but then I got to know the stroke is not done in nervous system, so how can it be completed? Yeah.